Hello, and thanks for hanging around. I know we're near the end of today. Thanks for the introduction. My name's Phil Bailey from an organisation called Pagero, and I'm going to give a perspective of what's happening in the NHS. Third story over 2 days about the NHS, so I promise I'll make it a little bit interesting. We've heard lots about artificial intelligence. We've heard lots of information about innovation and transformational change. So I'm going to, take a sideways step and talk about how organisations such as the NHS and their suppliers are using existing technologies better or differently to drive better patient outcomes, operational efficiency, clinical efficiency, and real cash-releasing savings, acting as a bedrock to enable artificial intelligence and modern technologies to derive from, but getting the basics right. So who are we? We're Pagero, originally a Swedish company, developed into a global organisation. People call us an e-commerce organisation, which I don't like. We're essentially a business network that enables suppliers and all of their customers, and hospitals and all of their suppliers to connect, to share all of the information that they need as part of their usual trading relationship. It's invoicing, ordering, catalogue information, price information, and everything in between in real time in a standardised and interoperable way. So that's about enough of us that you'll hear from today. So I just want to take you on a quick journey. Firstly, out of healthcare into the retail sector, and secondly, way back to 1974. I wasn't alive, and I'm sure most of you weren't either, but let me tell you about it. 1974 in the retail sector was a tough time. The humble shopkeeper was having a torrid time with embracing change. It was a time of high inflation, real volatility in pricing, and long queues. Prices were changing regularly. This was a time when shopkeepers would walk around their shops and price the shelf, price the product. Imagine doing that every day. Imagine the start of globalization where products were coming into their stores from all over the world, different products, different prices, volatility. It was a tough time, so there was need for innovation. Well, back in 1974, there wasn't a lot of talk around things like artificial intelligence. What the innovation was, successfully, was the humble barcode. So am I about to stand here for 20 minutes and give you a talk about the barcode? Well, no. I was going to say a joke about the barcode. I thought better of it. It's a thin line, and then a thick one, and then a thin one, and then a thick one. You can laugh. Thank you. But if I can't win you over with humour, let me win you over with a fact before we move on from the barcode. The barcode innovated retail in 1974. It enabled real stock control, real inventory management, point-of-sale scanning, all the technology that has derived that we know today that we use, the self-service scanners, the three-dimensional scanners, RFID, radio frequency technologies, all derived from the automatic stock and pricing control innovation barcode. Very boring. The picture on the screen, for your information, was the first ever product to be barcoded, Wrigley's Juicy Fruit. For those that want to go and pay homage to it, it's currently sat in a museum in Ohio in the States. So get your wives and husbands to take you on holiday there, if you really want to. So moving back to the healthcare sector, there are some drivers for healthcare. Why do we need change? And the barcode will become relevant in a moment, but first of all, we've come forward about 30 or 40 years. Why do we need change in healthcare? Why do we need innovation? Well, just a few examples of what happens today. First one, this is a falsified medicine. So these are drugs that are made illegally that work their way into the legal supply chain. Bad for brand, bad for image. Well, actually, it's extremely bad for patients. Best case scenario, it's a placebo, and there's no effect. Worst case scenario, there are inadvertent allergens or deadly toxins in that's come through the legal supply chain, over-the-counter prescriptions, can be very damaging. Things like never events happen every day in every healthcare organisation in the world. These are reported in the NHS. We get a lot of them. They're reported online and things are left inside people, there are wrong site surgeries. So there's need for change. The final example, on the top right-hand side of the screen behind me, is a breast implant. It's a breast implant made by an organisation called PIP, a French company that made for many years breast implants across the whole of Europe. Very popular in the private sector, but also in the NHS and rest of public sector. A number of years ago, it was discovered that they were illegally using industrial-grade silicone. Now, these were highly prone to bursting and were very dangerous for the ladies that they were implanted inside. So there was a product recall, and PIP went out of business. That was 10 or 15 years ago. What's the traceability there? The organisation shut down, but there were millions of operations and implants done across the whole of Europe. To this day in the UK, there are still at least 40,000 women with these implants inside them. That's the UK, that's regulated figures. That's tenfold across Europe. The answer is there is no traceability. At best, you can trace it to back door of a hospital, but implants simply weren't traced into a patient to this degree, without trawling through millions of patient records. So if we go back a step, and just go back to the retail example, I'll give you a UK example. In the UK, about 10 years ago, a big retailer called Tesco found horse meat in their lasagna. We don't eat horse meat in the UK, we don't want it, so there was a problem. Was it legal? Had it come from France by accident? Was it dangerous? Who knows? The outcome was that within 2 days, every impacted lasagna was taken off every Tesco shelf across the country. Within a week, they were able to track the whole supply chain down to where they bought it. Anybody who bought their lasagna with horse meat inside it with a club card, which is a loyalty card we have in the UK, they were able to identify specifically who bought that and write to them, give them another lasagna, I'm sure. If they can do that in retail in days and weeks for a lasagna, why can't they do that in every instance in healthcare across the world? But talking about the NHS, it's not possible. It's a very manual task. So that's one example of why there's a clear need for change. We, as a healthcare industry, suppliers, manufacturers, distributors, care providers, and regulators need to work together to drive transformational change, to drive better outcomes for our healthcare industry. Full stop. So off the back of that, we're seeing lots and lots of regulation. If there are pharmaceutical organisations in the audience, you would have heard of FMD, the Falsified Medicines Directive. That's trying to drive out those falsified medicines. If you work in medical devices, then you would have heard of UDI legislations around the world, but places like the United States are already implementing it. It's coming to Europe in the form of EU medical devices regulation, which is due to drop in the coming year or so. And in terms of electronic commerce, so I mentioned earlier we're an e-communications business network. We're seeing VAT and procurement directives that essentially says we're working towards everybody communicating electronically through e-invoicing and e-ordering as a starting point. So lots of regulation for different reasons, but there's convergence towards the same outcome. There's going to be better traceability. These falsified medicines and UDI legislations are saying uniquely identify your things. And by the way, put a barcode on them at least, or some other innovative technology, radio frequency, for example. That puts better information into the hands of caregivers. Talking about the NHS, it means that they can start to identify that as it comes into their organisation and automatically put that into patient records, which we're seeing in practice already. So specifically, the NHS in England. As part of this problem we're seeing in the healthcare industry, the Department of Health in the UK mandated contractually to all hospitals and all suppliers that they must adopt two things, GS1 and PEPL standards. Every supplier of every product and service into every hospital in the acute sector in England must adopt these standards. There are timelines and specific information about it. So 2 questions. What is GS1 and what is PEPL? GS1's easy. That's think about the barcoding. It was GS1 who invented the barcode in 1974, and you'll all be able to go home and tell your loved ones what the first ever product was that was barcoded, and where it currently is today. But by taking that forward to today, it's the simple patient wristbands. Identify the people that move in an organisation, the staff through staff ID, reps that are in there, so you can start to identify, are these people adequately qualified to be in this environment? Are they qualified to give that medical procedure, administer that medicine? Identify the places. Barcodes around the NHS at the moment, they're going around putting barcodes on walls and doors. Very boring, old technology, but using it differently so they can start to triangulate what's happening to whom and where. Now, the product's the interesting part because without a lot of work, they can't really control that. That's down to medical device, pharmaceutical, and non-medical manufacturers. The goods that they're taking in to use, to consume or implant into patients need to be identified in a standardized way, ideally, so they can start to take that out of the supply chain and into their patient pathway with minimal intervention, automatically. PEPL, the second part, it's a electronic standard of communication. So those familiar with EDI will know electronic data interchange. It's that business network. It's that communication between you and your trading partners that says, I'm not going to invoice you the amount of times I need to via paper, via email. I want to do this automatically from machine to machine. It's been around since the 80s. But what PEPL does, it drives a standard. Because the problem with EDI is you sign up to one provider, other people sign up to another provider, there's no interoperability. So PEPL offers the solution whereby providers like us, like Pagero, sign up to a charter that says that any hospital, any supplier, anybody who wants to build a trading relationship, sign up to anybody. Like us, if they've signed up to the PEPL charter, we will freely communicate with each other. An open, standardized network, sending standard information through from your financial system to their financial system. It's easy, but then they start to get that extra rich information. Serialized pharmacy products, batch numbered and uniquely identified medical device information coming through on those orders, on those invoices. Then, without pressing anything, they've got that extra rich track and traceable information into their care systems. They can trace it all the way from the supply chain, no longer the black hole that in the UK we know the NHS is. It got delivered last Tuesday, we'll never see it again. Clinical time is spent walking around hospitals looking for stuff that's been recalled that shouldn't be there. This answers the question. We know what we've received, we know where we've done it, and do you know what? We've scanned it into that room and that one's gone into Mr. X. They've got real-time traceability from the supply chain through the patient pathway and directly into patient records. So that's PEPL and GS1 standards. It was mandated in 2014 in the NHS, so over a number of years there's been a bit of activity. This is Lord Carter. He ran a review over 2 years, and the outcome of that review, amongst many other things, said that by the adoption of standardized information, better communication between the supplier community and the NHS, each hospital can save £3 million a year. That's not one-off savings, that's ongoing, sustainable, cash-releasing savings, which in the NHS we need. So there was buy-in from the top, but nobody really did anything because the NHS doesn't really believe when you tell them that it's a good idea. They're busy doing other things. So 6 hospitals were paid around £2 million each to try it, see if it works, put barcodes places, speak to your suppliers, see if you can get them, encourage them to adopt this new way of working with old technology. Because by doing that, you can build it as a foundational bed to build on new innovations and better technologies. Well, the good thing is, the 6 hospitals on the screen are coming to the end of their 2-year adoption period. They've put barcodes everywhere. Barcodes are coming in on the products. They're using radio frequency and new ways of identifying things, but they're able to triangulate. And the outcomes are already proving themselves just before the end of the program. So every single one of those trusts, and a large handful of other additional trusts, are showing real significant savings, not through investing in heavy IT products and projects, but by just doing things that are cheap or very achievable well and more efficiently and across the whole of their organisation. So we can see Portsmouth, and this was to do with inventory management. They got a return of 8.5 to 1 on their investment. It's 8.5 times the amount they spent. In Portsmouth, they actually gave 2 theatres, 2 clinical spaces back from ward stores to clinical space, places that they can perform clinical procedures, just because they were able to identify, to change the way they handle stock, to buy differently, more less often, less more often, it doesn't matter. The outcomes are there. North Tees have given nearly 4,000 hours back to nursing and clinical activity. These are hours that were estimated on duplication, on handling relationships with suppliers where they've invoiced for the wrong amount, where they've spent looking for product safety recalls, and lots of other things, because they're getting a clear and automated journey from the supply chain through PEPL standards, organisations like Pagero, straight from one ERP system to the other. The benefits are obvious. Derby Teaching Hospitals, they're a customer of ours. We partnered with them recently. They've made £1.2 million saving just in theatres. Well, in actual fact, this financial year, they're on track to receive £3 million plus in savings. And they estimate that that's ongoing every year, cash releasing savings, not just in inefficiencies and time back to care. I won't talk too much through the example on the right-hand side there, but that's a system that Derby are using, whereby they're taking the information via this electronic way of doing business, e-commerce, PEPL. They're taking that and letting it flow through their systems. Then in combination with the GS1, the physical standards, you can't move in any one of their theatres without being identified, without scans, whether you're a rep, a member of staff, a nurse, a consultant, a patient, or a product. They scan everything, and they've got down to real-time patient costing. So they know exactly how much every single procedure is. So their clinical director is able to make better decisions based on the information, based on the combination of EDI and GS1 standards. One clinician spends less time but more money on a procedure. One spends more money. The answer is not for us to answer, but it's for the clinical director to have those conversations with his staff, because he's got better information. Is it better to reduce the waiting time and have more people in the room, or is it better to save money? It's better that they've got the data in the first place to be able to make those decisions. So there are benefits to suppliers, and there are many, but these are a few. Where are those devices that I shipped? Where is the traceability? Where are I've got a product safety recall. Where is it? Who took shipment of it? Actually, can I support them in telling them exactly the information I need to give them? Okay, the NHS historically has been a black hole. You go to one trust, you go to Leeds, for example, they've got 7 sites. We took delivery of it in one site. You'll never see it again. You cannot search that amount of ward stores. You can't do it. This gives them better traceability through available, cheap or free, or technology they already have. This is barcoding and electronic standards. Once they've got that triangulation in place, they can start to do better things with it. They can start to go, what information am I buying? So on the procurement side, before it goes into the patient pathway, they can start to go, is this invoice ordered? Is it on contract? Is it at the right price? They can start to ask information, because it's electronic and in a standardized way. They can start to see what they're buying, whether it's on contract, whether shipping was allowed to be charged. They can automatically return it before a human being sees it. So it's saving so much time in terms of what they're doing in procurement and finance. That gives time back to healthcare professionals, clinicians, so they can start to take that data and put it into the patient pathway. And finally, I think 44 seconds and counting left, so I hope I've really engaged you today and given you some really useful information about the barcode, but really about what's going on in the NHS. There's lots more to talk about. Pagero, we're over there If you wanted to come and talk to us, then we're happy to give you some hints and tips if it's a journey you need to go on, but also more information about what I've spoken today. What I will close on is we talked about the benefits to suppliers, and we've also talked about the benefits to healthcare providers. But we're all here for one reason if we're in healthcare, and of course that's here for the patient. And wouldn't it be nice if the patient rights were there all of the time and not some of the time? The same is for devices, the same is for medicines. Thank you very much. It's been a pleasure.